Currently, the most common treatments for cancer both in Taiwan and worldwide involve chemotherapy and radiation therapy. However, such methods are most often only effective for patients with early-stage cancer and will also kill off healthy cells in the body. Thus, the medical profession has long sought to develop a treatment which only targets cancer cells without harming normal cells. In this direction, the Academia Sinica have recently developed a new type of anti-cancer technology, whereby sugar molecules found on the surface of cancer cells are synthesized into antigens. Such antigens then allow the body's immune system to produce antibodies which can fight off cancer cells.
Inside this Academia Sinica laboratory, sugar chips are being mechanized, and each probe contains different sugar molecules.
Once we have synthesized the sugar molecules on the surface of the cancer cells, we then use this machine to arrange the glycosylated molecules onto this glass chip.
Each sugar chip contains thousands of sugar molecules, and with just one drop of blood, one is able to conduct an analysis.
This method of detection can determine whether the patient's immune system has antibodies to fight cancer cells. And depending on the specific structure of the sugar molecules, we can determine the type of cancer.
Researcher at the Academia Sinica, Wu Zhongyi, says cell surfaces, even cancer cells, are coated by sugar structures known as glycans.
These uniquely expressed sugar molecules found on the surface of the cancerous cells through synthesis become antigens and developed into a vaccine.
Using sugar molecules as the basis, the Academia Sinica has developed two types of cancer vaccines, one for prostate cancer and the other for breast cancer.
Right now, there are no vaccines available which target cancer cells exclusively. There are, however, HPV vaccines which protect against infections that cause cervical cancer.
Unlike other antiviral vaccinations, carbohydrate-based vaccines for breast cancer may be one of the world's first vaccines to target cancer cells directly. With this new development, producing a drug which can inhibit cancer cells will become relatively feasible in the future. Current chemotherapy and radiation therapy, on the other hand, make it difficult to target just cancer cells without harming normal cells, and such treatment is usually only effective during early-stage cancer.
A tumor cannot be rid of entirely just with chemotherapy, and for this reason, we have developed targeted drugs. However, targeted drugs are currently only effective for treating chronic myelogenous leukemia. For lung cancer and breast cancer, these drugs are still incapable of treating the cancer completely.
Medical research shows that carcinogens contained in food and drink is the main trigger of cancer in 1/3 of patients. Smoking, excessive exposure to the sun, and excessive drinking are also among the other high-risk factors.
Paying more attention to our lifestyle and dietary habits are some of the measures we can take to prevent cancer.
Early detection of cancer greatly increases the chances for successful treatment and survival. Tomorrow, we take a look at the various stages of cancer and the methods of treatment available at each stage.